All right, today we're going to take a journey, a trip deep inside the lungs to really understand pneumonia. Now, it's a word we've all heard, but the story of what's actually happening is pretty fascinating. To really get it, we have to start by looking at what happens when our body's amazing defense system gets breached.
Think about it. With every single breath you take, you're not just inhaling air. You're breathing in bacteria, viruses, all sorts of microscopic stuff. So how come we're not constantly sick? Well, it turns out our lungs have this incredible, multi-layered security team working 24/7. But what happens when that team gets overwhelmed?
So to see what goes wrong, let's first trace what goes right. Let's just follow a single breath. Air comes in through your windpipe, the trachea, and then it splits off into this incredible branching network of tubes. First the bronchi, then the even tinier bronchioles, going deeper and deeper until it reaches the very end of the line, the alveoli.
Okay, picture this, tiny little clumps of grapes. That's honestly a great way to visualize the alveoli. You've got millions of these little air sacs, and they're all wrapped up in this fine mesh of blood vessels. This right here is where the magic happens. It's ground zero for breathing, where oxygen jumps into your blood and CO2 gets kicked out. It's the engine room.
Right, so let's get back to that security team, because it is seriously cool. First, you have the basics, the brute force defenses, like the cough reflex, which literally just blasts intruders back out. Then you have something called the mucociliary escalator. What a great name, right? It's basically a moving walkway of mucus that's always sweeping gunk and germs up and out. And if a microbe is sneaky enough to get past all that, you've got the final line of defense, macrophages. These are powerful immune cells just waiting down in the alveoli, ready to gobble up any stragglers.
But sometimes, a particularly tough bug, a real nasty one, manages to slip through all those defenses. It gets down deep, sets up shop in the bronchioles or the alveoli, and starts to multiply. And when that happens, you get pneumonia. Your body freaks out, sends a flood of immune cells, and the whole area becomes inflamed and starts to fill up with fluid. And that, of course, makes it really, really hard to breathe.
Okay, so our defenses are down, the alarm bells are ringing, but who are the bad guys here? Let's take a look at the actual microscopic invaders that cause all this trouble.
So the lineup of usual suspects falls into a few main groups. For adults, the most common causes are bacteria, like the famous Streptococcus pneumoniae, and viruses. And yep, that includes the influenza virus. The flu can absolutely lead straight to pneumonia. But it doesn't stop there. You can also get it from certain fungi, or even that special class of bacteria called mycobacteria, which includes the one that causes tuberculosis.
Now here's where things can get a little sneaky. Some types of bacteria cause what doctors call atypical pneumonia, or what you might have heard of as walking pneumonia. And it's called that because, well, you're still walking around. You don't necessarily have that high fever, knockout sickness. Instead, it's more of a lingering fatigue and a dry, hacking cough that just won't go away.
So we've identified the suspects, but now let's talk about the scene of the crime, because it turns out that where you pick up the infection makes a huge difference.
You can basically break it down into two main categories. The most common is community-acquired pneumonia, and it's exactly what it sounds like. You get it out in the community, just living your life. But then there's hospital-acquired pneumonia. This is when someone who is already in the hospital for something else gets it. And this one is a whole different ballgame. It is often much, much more dangerous.
So what makes the hospital version so much tougher? Well, someone put it perfectly. The microbes that hang out in hospitals have great offense and great defense. Their offense means they're super aggressive and potent, but it's their defense that's the real problem. They're often resistant to our best antibiotics. See, hospitals are like a training ground where the toughest bacteria swap resistance genes with each other, creating these superbugs.
And you've probably heard of the most famous of these superbugs, MRSA. Now, regular staph can cause pneumonia, and we can usually treat it. But MRSA, that's methicillin-resistant Staphylococcus aureus, has leveled up its defenses. It's resistant to many of our go-to antibiotics, which makes it an absolute nightmare to treat in a hospital setting.
Now, it's not always about inhaling a superbug from the air. You know that awful feeling when a bit of food or drink goes down the wrong pipe? For most of us, we just cough like crazy and it's over. But what if your gag reflex isn't working right? Maybe because of a brain injury or even from drug or alcohol use. Well, then that stuff can get stuck in your lungs, and the germs on it, or even just the acid from your stomach, can cause a nasty infection called aspiration pneumonia.
Okay, so the bug is in, the infection is on. What happens next? What does this actually look and feel like? Let's sift through the evidence, from the symptoms you'd feel to the patterns a doctor sees.
The classic signs are probably what you'd expect. You feel short of breath. You have pain in your chest.
A really big clue is a productive cough, which is just a clinical way of saying you're coughing up gunk. And of course, your whole body gets in on the action. We're talking a high fever and a feeling of being completely and totally wiped out while your immune system goes to war.
In one really intense type called lobar pneumonia, the infection actually progresses through these distinct, predictable stages. The lung gets so congested with fluid and immune cells that it starts to become solid and firm. They call this hepatization because, and this is kind of gross, the lung tissue starts to resemble the texture of a liver. Then, if your body starts to win the fight, it finally enters the resolution phase, where all that gunk gets broken down and cleared out.
So with all this going on inside, how does a doctor figure out what's what? How do they get the final verdict and confirm that it's actually pneumonia? Let's look at the tools of the trade.
A chest x-ray is one of the most powerful tools they've got. It's like getting a picture of the battlefield. And what's really cool is that the pattern of the white patches on the x-ray gives clues to the type of pneumonia. Is it spread out in patchy spots? That might be bronchopneumonia. Is it more of a net-like or line pattern? Maybe interstitial. Or is it all contained in one solid block in a single lobe of the lung? That's classic lobar pneumonia.
But it's not just about the high-tech stuff. A good old-fashioned physical exam gives doctors a ton of clues. They might tap on your chest. If it sounds dull instead of hollow, that's a sign it's full of fluid. They can even feel the vibrations on your back when you speak. Sound travels differently through that dense, infected tissue. And of course, with a stethoscope, they can literally hear the infection, these little crackling sounds when you breathe in.
So once the diagnosis is in, it's time to fight back. And since bacteria are the most common culprit, antibiotics are usually step number one. That's typically combined with other medicines to manage the symptoms. Stuff to calm the cough, ease the pain, and just give your body a chance to rest and focus on healing.
And that really brings us full circle, doesn't it? We talked about our body's amazing defenses, but we also talked about the microbes' defenses, those hospital superbugs with their resistance genes. And it leaves us with a pretty heavy question. As antibiotic resistance keeps getting worse, are we actually prepared for the future? Are our treatments and our strategies going to be enough to keep up with one of humanity's oldest and most stubborn enemies?